Welcome to Shaping Healthcare, a podcast by Citius Tech. I'm your host, Laurel Rockall. Today, we are joined by Pam Thompson, Vice President of Government Programs and Transformation Practice Lead at Citius Healthcare Consulting, and Benjamin Strong, Assistant Vice President at Citius Healthcare Consulting. Together, they bring deep expertise in health plan compliance, government programs, and business process improvement, offering valuable insights into the complexities of maintaining compliance in the ever-evolving regulatory landscape of Medicare, Medicaid, and ACA programs. Welcome, Pam and Benjamin.
Thank you. Nice to be here.
It's great to have you here. This is such a big topic when we're talking about compliance, but especially when compliance is combined with government health plan programs. There's a lot of very challenging aspects to it. So from your perspectives, what are the key factors that contribute to successfully navigating the complex and evolving regulatory landscape when it comes to these health plans? Ben, can I start with you?
Sure. Thanks, Laurel. Keeping up with changes in regulatory and program requirements is one key success factor. Plans have to continuously align their business processes and technology to ensure compliance. This includes keeping their documentation, their policies and procedures, training materials, and their team members updated. It's also key to have an enforcement or a corrective action element to address compliance incidents quickly and to restore performance if needed. Plans should be sure to document their actions so they can demonstrate to regulatory agencies and other stakeholders that oversight and monitoring is occurring. And they should have a compliance officer and team along with a compliance committee in place to carry out and govern these activities. What would you add, Pam?
I would just add knowing how your vendors and delegates are performing. So for accreditations like NCQA, you're responsible for ensuring that delegates are compliant. So external delegation oversight is a key factor in assessing your risk and sustaining compliance.
A lot of great factors that you mentioned there. And it sounds like really having everyone on board, having a team, having an officer, making sure that your vendors and delegated entities are also doing their part. And when we're looking at the whole landscape currently, what are some of the trends that you are seeing today in the realm of compliance for payers, Ben?
So there's already a big focus on data privacy and cybersecurity, and that trend continues given our deep dependency on data and the risk of breach by bad actors out there. Also, with the expansion of value-based care models and other advancements in the healthcare space, more and more information is going to be collected and shared, which means more and more information is at risk. You may have also heard of this thing called AI or artificial intelligence. With the industry's excitement and increased use of AI and machine learning, we'll see new regulations and requirements that payers have to comply with. And these will be around responsible use, patient equity, patient safety, and data privacy. And I would say another trend is integrated care and delivery models. An example of this is somebody who is eligible for both Medicare and Medicaid. In some areas, a dual special needs plan will integrate the Medicare and Medicaid plans. There are both CMS and state requirements that payers need to meet to be compliant with these integrated care models. Are there other trends I haven't mentioned, Pam?
Well, just a little bit more detail on the data that you were talking about with the greater focus the last few years on social determinants of health and health equity. Organizations are obtaining more data and different kinds of data than they have in the past. So I think what we'll be seeing is more trends in how they use that data. It'll be interesting to see how they changed population health programs and case management programs, things like that.
Yeah, absolutely. And in being in this digital age, yes, the cybersecurity aspect, the use of AI, those are all things that are going to be influencing and changing the way regulations and requirements are when it comes to compliance. So it's really great that you bring those up and bring those to our attention. Ben, what would you say are critical components that are, critical components are essential for sustaining compliant policies and these procedures?
Yeah, so we've covered some of the key factors and components. In addition, I would say it's critical for organizations to be nimble and to adapt their policies and procedures as often as necessary. A payer may find that updates they made in the last quarter need to be updated again already, and they need to be able to act quickly and do that. There also needs to be clear and effective communication and reporting channels in place that are readily available and easy to use. such as hotlines, email, or reporting from the plan's website or intranet. And then I would say risk assessments need to be done proactively so that organizations aren't relying solely on reporting of incidents by other stakeholders. What do you think, Pam?
On keeping up with changes, I think you're spot on there. Sometimes it's really hard to identify the impact of regulatory changes on operations. So you have to read through a lot of material. For CMS, it's the HPMS memos. And so a lot of material to try and find out exactly what might impact you. And then when you do find it, the language is sometimes ambiguous. And so operations departments are hard pressed to find time to just read through them, looking for what applies to them. And then there's the question on how to interpret them. So having some kind of standardized process with clearly defined roles and responsibilities is crucial to sustaining compliant policies and procedures.
Absolutely. You mentioned the speed of change and how much is happening that fast. There's a lot of challenges there. So, Ben, what challenges do payers typically face in developing and being able to maintain compliant processes?
Yep. Well, you already hit on the rapid pace of change. That's a big one. And it is constant. And if payers don't have a structure and dedicated resources in place to identify, to interpret them, as Pam just mentioned, and adapt their operations and products to these changes, it's only a matter of time until an incident or an audit finding forces them to address it. I would say another challenge is the lack of resources. I'm not only talking about the compliance team, but the functional areas the compliance team works with and supports. They need to have the bandwidth to update, to test, and to implement any changes to their business processes, their policies, procedures, and training materials, and to train their staff. It's also a challenge when a vendor or a delegated entity doesn't report a potential compliance incident, or they may not even know they're not in compliance. This is why it's so important to be proactive in identifying and assessing risk instead of waiting for risks to be reported or realized.
You've listed quite a few challenges there and things that might be hard to wade through when working with compliance in these programs. Where do you see the most health plans struggling when it comes to their compliance?
Yeah, so some of the common struggles that we see are health plans overlooking what they might think is a small legislative update or minor, and assuming that they're already compliant without validating that they are. Another area where we see plans struggle is keeping their business processes, their technology, their policies and procedures, and again, their human resources up to date. And then lastly, I would say that the struggles that plans face is being proactive in identifying potential compliance incidents.
We've shared quite a few challenges here. What would you say are some of the best practices that you've observed in compliance?
Yeah, so some of the best practices we've observed are when there is a culture of compliance at an organization. This means that the team members understand and value compliance. They know that potential incidents will not be ignored, and if they report a potential incident, that it will be addressed and there will be a response. Everyone is a stakeholder when it comes to compliance. Another best practice is having robust monitoring, auditing, and oversight programs in place. Proactive monitoring and auditing internal and external stakeholders identifies potential compliance incidents faster than waiting for those to be reported or again to become apparent. Also, approaching business processes, technology, and compliance from a continuous review and improvement perspective can really put an organization ahead of the game instead of having to frantically work to become compliant or adapting to regulatory updates and requirements after they're already in effect. There are so many best practices. What would you add, Pam?
Well, we've seen various levels of accountability for implementing and maintaining regulatory changes. But the best practice we've seen is when there's a central department like compliance who triages the memos, identifies the responsible party or parties, and assigns tasks to specific department representatives. So it's the department representative's job to implement the change or respond back if they don't think it does apply to them so it can be reassigned. So it's a team-based approach.
And with the team-based approach and being proactive and everyone lending a hand, if you will, and being accountable with this, with that, what kind of tools and technologies can support payers in to strengthen their compliance efforts, Pam?
Great question. More and more health plans are using technology to support the compliance efforts. So there's third-party software out there that's very good. It tracks and reports activities. You can set up key performance indicators. They have built-in data security assessments, incident reporting and tracking, so pretty robust. These tools are interactive, so you can have a central repository that everyone goes to review policies and procedures. They have version control. They can flag what's due. So everybody's on the same page of what's going on there. It also provides the dashboards and reports that everybody can look at. Compliance is also an excellent opportunity, as we mentioned before, for artificial intelligence and Gen AI even to anticipate compliance risk or potential incidents and identify possible solutions. And the last thing, though, is standard process improvement tools. I'm a certified process improvement practitioner, so I can tell you there are a lot of different tools out there and methodologies, and one size doesn't always fit all. But the simplest one and most popular tool to use for compliance is root cause analysis. But depending on the severity and complexity of the compliance issue, you can use Six Sigma, Lean, or even PDSA as rapid response. But overall, it's best to foster an overall environment of continuous improvement.
Pam, I'd like to build on that answer here. How does conducting a thorough root cause analysis help address compliance issues effectively?
Well, I'm glad you asked, because truly this is the magic bullet. If organizations take time to identify the true root cause, they can fix the real problem, and which dramatically increases sustainability. A lot of times, with due reason, people find a problem and they want to fix it. And they might go with the most obvious cause and the most simple solution. But sometimes that just puts a Band-Aid on the real problem, and you find out later that still is a problem. So doing due diligence pays off in the long run.
Absolutely. You mentioned that, if these doing a root cause analysis of what is finding a problem, or maybe they're finding that they're putting these Band-Aids on these issues and finding out these problems are a little bit bigger than them or what they can do. When should health plans consider bringing in consultants for compliance support?
There's so many areas where consultants can help in just standing up an initial compliance program, or if you're thinking about implementing a standard methodology for process improvement. There's consultants who have been doing this for years, and they can evaluate your program, make recommendations for improvements, assess your risks. They can help you select software and implement it. There are experts out there who can do really good vendor and delegation oversight. They can help you write policies, procedures, provide audit support if you have never had a CMS audit and you're going through it the first time. It might be helpful to have some experts come in and train and coach you on the audit. They can set up internal controls, reporting, all that good stuff. And if you do have a non-passing audit report, consultants can help write and implement your corrective action plan. Or sometimes consultants can just be put in place to do the day-to-day operations while a strike team is working on the corrective actions.
These are, you've really both have brought some really great insights and bringing your expertise to the table on what compliance is looking like, the challenges of it, what that looks like specifically when it comes to these government health plans, and how everyone really needs to be working together and moving forward with this as it's always evolving and always changing here. So I would love to get your closing thoughts on this. Pam, I'd like to start with you.
Sure. I think the main takeaway today is that compliance is everybody's job, like Ben mentioned. So developing a culture of compliance is the best thing you can do for your health plan. It's an ongoing, it's not a one sentinel event. It is an ongoing training, retraining, and having everybody understand what a compliance issue is, when to report it, and they all have this notion of continuous process improvement can be really helpful. And you can be proactive that way instead of waiting for an audit and getting a result that might not be favorable to you. So using standard methodologies based on the size of the problem can position the organization for rapid response and resolution to any compliance issue that might arise.
I think Pam nailed it. It's about being proactive. It's about it's a culture, and everyone's involved, and it's continuous. It's not a one-time thing. And make sure that you are identifying those issues instead of your customers bringing them to you.
Thank you both, Pam, Ben. Thank you both very much for being with me today and talking about this. It's been a real pleasure.
Thank
Nice
you
to
so
be here.
much.
Thank you.
The Shaping Healthcare podcast is brought to you by Citius Tech, a leader in healthcare consulting and IT services. To find out more about Citius Tech, visit citiustech.com. To listen to more interesting insights on healthcare technology and innovations, search and subscribe to the Shaping Healthcare podcast. Thank you for listening. If you want to share any feedback or would like to be featured in our podcast, do write to us at citiusvision@citiustech.com.